For all of you that are on right now, thank you so much for taking the time out of your busy life to join me on this webinar. I am Dr. Andrea Purcell, and I use natural medicine as the first resort to help you find the underlying cause of what's going on and treat it naturally without drugs or surgery. And a little bit about me, I've been practicing naturopathic medicine for over 18 years. And I started out in Orange County, California, and then I relocated to the Phoenix, Scottsdale, Arizona area. I've heard from a lot of women, lots of stories, lots of plastic surgery related mystery illnesses, mostly related to breast implants. And I am your host this evening. I'm going to be presenting on immunity, stress, and implants. I want to say that there is absolutely nothing wrong with seeking out beauty. You know, as women, we are just these nurturing creatures, and beauty, when we are feeling so good, it just oozes out of us. And the beauty, the desire to be beautiful, it just comes from deep inside of us. And, you know, we have the beauty industry and the medical industry, which have kind of capitalized our desires and have really, you know, developed things to help us even enhance our beauty more. And there's really nothing wrong with helping women feel more beautiful, because, you know, everyone in our world benefits when we feel good and we're happy and balanced. And, you know, my position is it would all be fine and good if we could leave it at that. And if every beauty enhancement product on the market were safe, but the truth is that they just aren't. And if you're not informed, or you only pay attention to the marketing, then you can fall into really some deadly traps. So the main point here is, I don't feel that beauty should come with the price of losing our health. So I am a naturopathic medical doctor, and I'm not an MD. I'm not a DO, a DC, or a PhD. I'm an NMD. And what that means is that I just use natural medicine as the first resort in my practice with the women that I work with, but also with my family, because I'm Gerardo's wife and I'm Braulio's mom. And really, who wants to watch and wait for a disease to develop when there's something that can be done today to reverse and prevent it? And that makes sense, right? I actually had a woman, she came to one of my talks and she said, "That's exactly what happened to my husband. He had really bad gastric reflux and they were watching and waiting. And then the next year, he just developed esophageal cancer. And there wasn't anything that anybody could do. And I lost him shortly after that. And then I've had to raise, you know, our daughter on my own for the last 15 years. So that's really what we're talking about here. There's no time to watch and wait and, you know, see like, oh, is my health going to get better when you're really suffering? Because we're dealing with you, your life, like real people with real lives, and you have people who are counting on you. So tonight I want to get really specific and clear as to how we can protect our own health. So this webinar is going to be about 60 minutes long. We're going to cover a lot of ground. There's tons of good information packed into it, and I want you to stay around to the end. So for those who stick around to the end, I am going to be offering an opportunity to schedule a free phone call with me. It's a way for us to find out more about you and your needs, and if what we do is going to be right for you. So my intention tonight is not to be fear-based. It's just to provide information to help you get some answers and understand why some things may be happening in your health and your body, and things that no one really has ever presented to you in this way before. So I do want to share my screen right here so you can see the PowerPoint presentation. And so just take me a minute and then we can flip over to that. Just give me one more minute to do that, and I'll be right there. Okay, so now I just have to move this chat box around so I can have you view it as a slideshow. All right, there we are. So immunity, stress, and implants. So this is what we're going to cover in this webinar tonight. We are going to cover COVID-19. I know COVID and immunity are in everybody's mind these days. We're going to talk about America's healthcare crisis, definitely inflammation and immunity and how it connects to implants, and how to take action and protect your health naturally. So you may feel like you're in crisis right now, and we really are as a nation. It's important for us to understand that our country's healthcare system has really been in crisis for a very long time. And it's one of the reasons why many of the women that I work with haven't gotten the answers for their inflammation, their pain, and a lot of conditions that really tend to set in around age 40. You know, and it's funny because when I turned 40, one of my girlfriends said to me, you know, well, welcome to 40, the decade that your eyes go on you. And, you know, is it just inevitable that our eyesight goes when we get into our 40s? You know, and I don't believe that it is. You know, I just had a practice member, she's in her late 50s, and she called me all excited and she said, you know, my eyesight is improving. I just went to my eye specialist for the second time in 2 months and he couldn't believe it, but my macular degeneration is getting better. So, I mean, it's exciting to share, but it's also like we can't just accept that our health declines and that we are powerless. So we're going to talk more about immunity and stress and then how you can protect yourself naturally. So I want you to walk away from this presentation realizing that you have more control than you thought you had. And the truth is, we can't stop aging, but we can balance our systems and we can optimize our health. And it's so that we can thrive and not just survive. All right, so we are going to cover a little bit about COVID-19, at-risk populations, and how to be proactive. Just quickly here, you probably already know this, but the high-risk populations are people, really 6 main categories. People with lung disease, renal disease, which is kidney function, heart disease, so that includes people with high blood pressure, diabetes, so blood sugar instabilities, obesity, so having a body mass index greater than 30, and then certainly age. Unfortunately, 40% of Americans fall into one of these categories. And the sad part is that these conditions often have a lifestyle or a dietary base behind them that could have been addressed to prevent these things from developing in the first place. So what's happening with COVID is it's really hitting people hard because they have these underlying conditions. And, you know, I know for me, it's kind of sounded the alarm bell, like it's not okay to walk around with these and think that we're fine. Because when something with COVID comes, it really, you know, threatens the health that we thought that we had, but we really didn't have. So I want to talk a little bit about breast implant illness and the definition of it now, just right up front, so that you all have a deeper understanding. Maybe some of you know exactly what this is. Maybe some of you, you're just hearing this for the first time. Breast implant illness is really a wide range of symptoms that can develop after undergoing surgery for breast implants for any reason and any type of implant. And it's most likely, right, because the cause is unknown, related to some type of autoimmune reaction in the body to the chemicals, the heavy metals, and the silicone polymers that degrade, that are contained within the implant, that degrade within the body over time. And you can read here for yourself what some of those symptoms are. And you know what? All of those symptoms are just like mystery illnesses. They just fall into this trash can of like, oh, that's just chronic disease, or oh, does that happen to us as we get older? And, oh, you could have Hashimoto's thyroid, right? Because it's just kind of this not very specific blend of symptoms that can result from having implants. It doesn't mean that we can't be proactive and do something. So how each one of us responds to COVID-19 really depends on these 2 factors. And I want to say if a woman is dealing with breast implant illness, it really depends on these 2 factors too. And so they're just really important to look at. So with COVID, we want to limit our exposure, right? And so we've done that really well as a country and as a nation. We've flattened the curve. We've reduced that. We've implemented public health measures. And then two, the next thing we want to do is we want to decrease our susceptibility to COVID. And then how do we do that? Well, we want to lower our risk factors and support our body through proper diet and lifestyle choices. And guess what? It's the exact same thing that we do when we have breast implants, especially if we're dealing with breast implant illness. What we want to do is we want to limit our exposure. So what does that mean? Do we need to be explanted? And two, then we want to strengthen our system and support our body through proper diet and lifestyle choices. So I don't want you to feel like, oh, there's nothing we could do. There's a lot that we could do. You know, we can do something. You know, I can't change my age, and I don't think that you can either, but these are all the things that we can do to help ourselves, you know. And I've been communicating a lot, you know, with all of our practice members over the last month and a half. And, you know, I said, you know, it's like we're in training right now to condition our bodies to be as healthy as possible. So when we are exposed to COVID, like we have a very mild case or we're asymptomatic because we've done the work. And it's the same thing here about helping take responsibility and being proactive with our health. So, yep, that's what this is. This really is a wake-up call to be proactive. And so the way that I look at the body and the way that I want to encourage you to do so too is just recognizing that there are all these different pillars of health. And in order to have a strong body, we have to address all of these pillars. And so that when a disease comes at us or a stress comes at us, we're able to fight it off. And so what are the important pillars of health? Well, they're nutrition, their proper hormone balance, exercise or body movement, body cleansing and detoxification, absolutely stress management, immune function, helping our immune systems function better, and then digestive health. And I'm going to cover all of these and how they relate to what we're talking about tonight. So if you've been to an alternative practitioner before, the way that I practice and the way that I look at the body is different because I incorporate all of these things into the approach that I take with every single woman that I work with. And that really allows me to get the results that we do and help you get to where you want to go faster. You know, because a lot of people have been to a lot of doctors, and maybe you have too, and you've tried a lot of things, and it's so frustrating to not get to where you want to be. So, you know, my goal is to take this comprehensive approach to help you build your body back up so that you're as strong as you possibly can be. So if you're just tuning in right now, we talked about COVID, we've defined breast implant illness, and now we're going to talk about America's healthcare crisis, stress, immunity, and how you can take action to protect yourself. So please stick around to the end where I give you a great opportunity to book a free phone call with our office so you and I can talk more about where you want to go with your health and what you're looking to achieve. So a little bit, let me ask you, what's your why, right? Because I'm on a mission. I'm on a mission to help women stop surviving and start thriving. So I believe that every woman has the ability to take back control over her health, and all that she needs are the skills and knowledge passed down from another woman who has already done it. So I get up every day and I do what I do, and I'm so passionate about it. I know that women are here to serve, and we all are here for a purpose, and we can't do that without having good health. And to help you get your health back, that's what I'm passionate about, because I know that greater health translates into better relationships, more energy, feeling happier, and then just more of you gets to trickle down into all the people in your life. So this is the important part of the webinar. If you're just tuning in, it's time to get quiet and just silence your cell phone. And I really just want to get real about what's happening with healthcare in this country. So let's take a look at this next slide. I think this is it's pretty eye-opening, and it's really clear. So this is the total number of breast reconstruction surgeries that were done in 2018. And what you'll see is that there were a little bit over 100,000 implant surgeries. And out of those, 82% were with implants, whether it be saline or silicone, and 18% were autologous, which means taking your own fat and reconstructing breast tissue from your own fat. Of those surgeries, 88% were silicone filled and 12% were saline filled. And you can read these numbers on your own. A little bit over 300,000 of those were cosmetic augmentation. The rest mostly were for breast reconstruction, for deformity, mastectomy, other things like that. Just really eye-opening to see kind of where we're at in this country with the amount of surgeries and what the breakdown is. So, you know, a little bit about me. I was fortunate enough to really get connected with my body at a young age. I remember and I was in the gynecologist's office, and she hadn't run any labs. She did an exam on me, and she said, "You need to go on birth control because you have a hormonal imbalance." And I said, "I do?" I said, "How do you know that?" And she said, "Well, because you have more hair than is normal." And I looked at her like she had two heads, because I'm thinking, yeah, I'm half Italian lady. Like, half the women in my family are like hairier than me. Like, you want me to go on birth control? And doesn't that cause weight gain? And doesn't that cause cancer? You know, and there was no labs, and I just walked out of the office that day just shaking my head. And, you know, I ended up at the local health food store, and I bought the equivalent of what was like a health Bible. And for the last 25 years, I just really spent learning and studying to help women, you know, take back control over their health. So we just don't get told something, and then, you know, if there's nothing to back it up, or if it just doesn't sit well with us, we just don't go along with it. And that's a picture of me and my son there, and I'm an older mom, and I'll talk about that. But I know that some of you came here to get information, and I know that some of you are looking for help too. So I'm not going to leave you hanging. I am going to give you an opportunity to get your questions answered, and stick around to the end, and you can schedule your free discovery call, and we can talk more about you. So yeah, I'm an older mom, and I take care of myself, not just because I want to walk my talk, because I help with women all day, every day, but also because I want to be there for my son when I'm 50. I want to be on the soccer field with him, and I want to hike Grand Canyon with him, and I want to give him the best chance at having a mom who models for him what it's like to be healthy. And, you know, I talk about this because often I see women so conflicted, because we tend to put ourselves last, especially when it comes to our health and getting our needs met. And we prioritize the people in our lives and the things in our lives before ourselves. And honestly, I mean, I'm guilty of it too. I mean, it's just that I'm at the point now where I recognize that I'm doing it. And I think, gosh, you know, I'm really going to be exhausted and cranky. And then I'm going to say things to the people that I love that I'm not proud of. And so I'm able to pivot out of it. But it takes practice for us as women. And I don't want you to sell yourself short, because I believe that we all have a purpose in life, and it's impossible to live out your purpose without having good health. Yeah, really. And I believe that you have the ability to take back control of health. You just need the information, the skills, and the knowledge passed down to you, and someone to help you and coach you along the way. So here we are. We're in a nation in crisis now. You know, really medicine today is divided into two parts. It's like 10%, which is crisis care. And that's where we've got some of the best and the brightest doctors to help us through crisis. You know, you break a bone, you have a stroke, like, you know, amazing work there. And then 90% of medicine is chronic disease. And that's the, you know, the mystery illness, the anxiety, the depression, the I can't sleep, doctor, I've got gastric reflux, I got irritable bowel, I'm so tired. Do I have chronic fatigue? You know, it's Hashimoto's thyroid, the list goes on. And the truth is that the insurance card that we all have is really great at treating crisis. It's terrible at treating chronic disease, because they just throw Band-Aids at us, like medications, and, oh, you could go for this surgery or this procedure, but it really doesn't fix anything. And when we look at the risk factors for COVID, right? Obesity, blood sugar issues, heart disease, high blood pressure, lung issues. All of those people, the 40% of America, were given medications. They weren't told how they could reverse it and strengthen their body. And that's why I'm so passionate about this, because we've really been given like this false sense of security having insurance cards, that the system is going to take care of us. And honestly, it's the same for thousands of women struggling with breast implant illness, because breast implant illness is a chronic disease and there is actually no treatment for it that the insurance card can use, right? So that is well known, right? Us in alternative medicine, I work with women with breast implant illness all the time, right? And there's a lot that can be done because natural medicine works to get underneath it and to treat the underlying cause. But that's not what's happening in the conventional area. They're just bandaging things. So, you know, I have a woman right now I'm working with. She's you know, in 30s, like low 30s. She just got married 2 years ago. She got put on birth control 14 years ago as a teenager. And she wanted to start a family. We're working through some of her health issues. We talked about her going off birth control, what that would look like. She was really scared. She said, you know, I don't know if all my symptoms are going to come back. I got put on birth control for a hormonal issue, you know, 14, 15 years ago. And I said, well, you know, that's why we're here. The time is now. This is what you want to do. Let's help you get there. And so she stopped her birth control, and lo and behold, all of her symptoms came back like a freight train. And, you know, I talked to her and she was like, I'm just really angry. I'm really angry that that birth control pill didn't do anything to fix my hormonal imbalance. And that's why they put me on it. And I said, yeah, so now let's fix your hormonal imbalance, right? And so she's doing better now. But the point is that having insurance often stops us from moving forward and being proactive with our health because we think that it's being managed. But it's not being fixed. It's just being covered up. So, you know, maybe this makes perfect sense to you and you already know this, or maybe you're hearing it for the first time, but, you know, just really to drive the point home, I say, hey, we've got car insurance. If we crash our car, we get a new car, right? We have a house, we have fire insurance, the house burns down, we get a new house. We cannot get a new body. It doesn't work like that. So that's why I'm so passionate about really what I do and talking about this, so that you can take your health and put it back into your own hands, and you're in the driver's seat and you call the shots. So let's look at the pillars again just quickly. If you're just hopping on here, these are the pillars of health. I reviewed them briefly a few moments ago. Every single one needs to be addressed in order for you to feel your best and to be healthy. And so what I want to do right now as we go through is I'm going to cover each one of these pillars and how it pertains to what we're talking about tonight. And just seeing how, if you have implants on board, it can impact each one of these pillars. All right. So this is the new proposal by the Food and Drug Administration to put a warning on breast implants, and it's called a black box warning. And what that means is that every drug or every medical device, if it has a black box warning on it, it has to be verbally told to the person or the patient. They have to sign off on it and they have to agree to it. Like, say, for example, if it was a medication that had really severe side effects, it might cause birth defects or something like that, the woman would have to be notified ahead of time, and she would have to agree that she understands the warning and that she wants to go ahead with it anyway. Okay, so 2019 was a huge year for breast implants and information coming out on breast implant illness. And actually at the end of October, the FDA made this proposal, and it's right here in front of you. And basically what they're wanting to do is put the warning on breast implants, and then also include a patient decision checklist to accompany all of the labels. And this is what they include. Breast implants are not lifetime devices. your chances of developing complications, they're going to increase over time the longer you have the implants in. Additional surgeries may be needed to address the complications, right? And then this has been known for quite some time that implants are associated with developing a certain type of T-cell lymphoma. And then this is interesting, and this is really all of the women that I've seen over my career. It's breast implants can be associated with systemic symptoms such as autoimmune processes. Okay, and that things get really, really interesting. And you'll see, or if you refer back to the breast implant illness slide, a lot of those mystery symptoms that just look like chronic disease, but all of them can be autoimmune processes that are happening. Okay, so let's talk a little bit about stress here, right? So stress can cause anything, and different types. Just a quick story here. I had a woman come in that I ended up working with. She found me online. She had Hashimoto's thyroid. She had joint pain, fog, neuropathy, really, really bad brain fog. She would just say, I'd be at work like I'm supposed to be managing this company or this division, and I just, it's like cobwebs up there. And she's like, I can't get it all done. And she was so exhausted, she would just work all week, and then on Saturday she would just collapse, and she'd have to rest all weekend in order to get back to work on Monday. So she had like no life, right? And she said, I think it has something to do with my implants. I actually met with a surgeon, and I'm going to have them removed. And it was removed in November. And I said, okay, great. Well, that's a good place. And that was 18 months ago. I worked with her after she was explanted. And honestly, it was the beginning of her journey. Like once the immune response had been removed, we work on every single one of the pillars that I'm going to take you through in order for her to clear her mind, clear the cobwebs. The brain fog is gone. The energy came back. Neuropathy. I mean, every single thing that she came in with, right, is better. She's still on thyroid medication, but that's like probably going to be the last to go. Are they a stress on the body? Quite possibly. Yes, they are for many women. So, and in these times of stress is at the forefront of our mind. So I want to run through the different types of stress and then talk about each one. So we have physical stress. Okay. So if we crash or we get in an accident or something happens to us in a lot of pain, that is an incredible amount of stress on the system and can lead to depression, because living with chronic pain or having injuries, very draining overall. Then we have chemical stress, which I'm going to get back to in just a minute. And then the final stress is emotional stress. So when I ask the crowd, hey, are you stressed and what are you stressed about? I hear like 15 emotional stressors that come right off the bat. I'm stressed about traffic. I'm stressed about my job, my spouse, my kids, my teenagers, work, it just snowballs from there. So emotional stress is very real. And I know that especially during this time where we're in a number of different crises in this country. But chronic stress can actually inhibit the immune response, and it can lead to increased susceptibility to infection and lowered immunity over time. Emotional stress can deplete our hormone levels, cause sleeplessness, worry, anxiety, overwhelm, and just really hit us in our weak spots. People say, I just have a nervous tummy, or my digestive system is not good. And we're going to talk more about the digestive system and how much of the immune system is actually housed inside the digestive system. And so one of the stresses that we tend to not think about much is chemical stress, environmental stress. And most of the time it's because we can't see it with our eye. But COVID is an environmental stress, right? It's all around us. We're wearing masks, gloves, we're in quarantine, but we can't see it. And so chemical and environmental stresses are very real, and they can make us very sick. Chemicals have a way of being on and off our hormone receptors, and they're actually called endocrine disruptors because they disrupt our endocrine system and all of our hormones. The main issue with breast implants is the kind of the chemical and environmental stress. So even if you have a saline implant that just has a silicone shell, you maybe talk to your doctor about it, you're thinking, well, it's just saline, that's salt water, right? Isn't that all that's in there? And the answer is no, that is not all that's in there. The silicone shell itself can break down over time due to body heat. What I noticed is that women who are avid exercisers, cyclists, like this particular woman that I talked about, right? When I started talking about stress, she was an avid cyclist. People who are dancers, people who work out a lot, take a lot of HIIT classes, marathons, half marathons, triathlons, they tend to get breast implant illness fast and furious because the changes in the body actually cause the implants to break down faster and leach toxins into the lymphatic and the bloodstream. So breast implants contain heavy metals. They have the silicone in them, plastic polymers that leach out. And, and the best way for me to explain this is, have you ever left anything out in the sun, right? And it got sun damage. Maybe you had some patio equipment, or you had like a plastic blow-up pool or something for one of your kids, and then it just totally cracked, like the paint stripped off the patio furniture, deteriorated. Well, that's really what happens with implants in the body over time. And the faster they deteriorate, the sicker somebody can get. So with heat and exercise, the exact same things happen to us. So the breakdown products, or the chemicals, they create a huge stress inside of our bodies. And it's just another thing that our livers need to manage and cleanse and detoxify. And honestly, they just can't keep up with all of the work and how much they need to do. So decade after decade, year after year, our livers get bogged down with toxins. And that's one of the detoxification, one of the really important things that I work on with women, because we have to make sure that the body is able to properly cleanse itself and eliminate. And I'm not talking about ruptured implants. I'm talking about perfectly fine implants that are stable in a woman's body. They can still leach, and she could still get these symptoms. So a rupture is a whole nother can of worms. I'm just talking about ones that, you go for the ultrasound, like the woman shared at the beginning, and everything seems fine, conclusive. Let's talk nutrition a little bit. So in order for it to be healthy food, it has to meet these 3 criteria. It has to be able to sustain life, provide energy, and promote growth and repair of tissues. If it doesn't do one of these things, it's a junk food, a fast food, or a processed food. And the truth is, know that nutrition is important. I really feel that nutrition, food is our medicine. And food can be the safest, most powerful form of medicine, or it can be the slowest form of poison. And we can slowly poison ourselves over time. So when I'm working with a woman and she wants to be healthy, yes, food is absolutely important. There's just a lot of conflicting information out there. That's why there's so many books and so many diets, because it's different. It's not the same for each person. And that's why, depending on where you're at and what you're dealing with, you need your own set of personalized and individualized recommendations to help you get over your struggles and your hurdles to get really to where you want to go. All right, so let's talk a little bit about digestion. Digestion is the foundation of health in so many ways, and it's where our entire immune system is regulated. In fact, 80% of our immune system is found in our digestive system. I know I say that sometimes and people are like, wow, really? Is that true? Yes, absolutely. So as our body responds to stress, guess what? Blood flow to the digestive system slows down, and it causes a disruption in our digestive system's ability to break down food. And then there's imbalances in bacteria and viruses and funguses. And then we really end up with serious digestive problems. Things like irritable bowel, gastric reflux, gas, bloating. I can't tell you how many people come in and they say, I just feel like I'm 9 months pregnant. Can you get this bloating to go away? Abdominal pain, diarrhea, constipation. And then there are certain medications that also interfere with digestive function. So antibiotics, acid blockers, all negatively impact digestive function. A healthy digestive system helps decrease inflammation in our systems. And so as more information is being released, because we're, every day more information is being released on COVID. And what we're seeing is that people with a healthy immune system who don't have a lot of inflammation are doing better handling this virus. And that's even going to be true once we get to the development of the vaccine, because one of the biggest problems creating vaccines for coronavirus is that they have a lot of inflammation in someone's system. And if someone is already inflamed, they don't do as well with the vaccine. There's a lot of serious side effects. So fixing the digestive system lowers our level of inflammation. And that's very important in our entire body and in our brain. And really, how many of us want better brain function? I know I do, right? I could always be better. I could always be sharper. Yeah. So, and I have a woman that I'm working with right now. She completely lost her health as a result of having breast implants. She had a rupture and went on to develop an autoimmune condition called celiac disease, which is all digestive based. And she just wasn't able to absorb her nutrients, anything. And, we're just working really hard right now to help replenish that, because I know once her digestive system is fixed, her level of inflammation is just going to come down considerably. So I wanted to share this with you. This is a new study that just came out last year, long-term outcomes in women with breast implants. This is out of the University of Texas there. It was published in the Annals of Surgery. They studied the medical records of almost 100,000 women. I mean, that's significant. And when it comes to autoimmune conditions, this is what they found. Women with breast implants over a long term, so have had them for a long period of time, 8 times more likely to be diagnosed with Sjogren's, which is an autoimmune condition, 7 times more likely to be diagnosed with scleroderma, an autoimmune condition, and 6 times more likely to be diagnosed with rheumatoid arthritis. Yeah, I have a woman that I've been working with. She was one of the first women to get silicone injections, before breast implants were even put in pouches and things like that. And she's got a terrible case of rheumatoid arthritis now. And that can't be taken out because they just injected the silicone literally in this big syringe, like right underneath the pectoral muscle belly there. Yeah. So more information is coming out. Like I said, 2019 was a really big year for helping get some of the awareness and why women are struggling and why they're so sick. It's just really important to get the information out. And if you're not, maybe you have implants now and you're fine, that's great. I'm happy for you. However, there are a lot of women struggling and they don't know why they're struggling. And their moms and their daughters and their sisters and their aunts, and they have people in their lives who they want to interact with and participate with and be here for. And, and that's why we're really talking about this. So I want to talk a little bit now about testing. So when you go to the doctor, right? Actually, I had a woman, she went, before she came to see me, she said, hey, I've been caregiving for my mom. I'm exhausted. Caregiving is a very difficult job. So any of you are doing it, my heart goes out to you. I know how it's the hardest job on the planet. She came in, her hair was falling out. She was exhausted. She had no sex drive. And she kept getting sick all of the time. We ran a TSH level with her, and this is what you have on your screen right in front of you. TSH stands for thyroid stimulating hormone. It's a blood test for thyroid, and her level came back at 3.8. So what you'll see in front of you is you'll see a blue bar, which is the normal range. The entire blue bar is the normal range. And then you will see a black dotted line, which is the optimal range. So her level came back at 3.8. Which is in the normal range, the blue, but it's not in the optimal range, right? And she had all of these symptoms of low thyroid. And what happened is I said, you have underfunctioning thyroid and we need to get it addressed in order for you to feel your best. And she said, oh, that's funny. She said, I went to my doctor and my doctor said my thyroid was fine. And I said, yeah, it's because it's in the normal range, but it's not in the optimal range. And this is one of the reasons why women get so frustrated and they come home from their doctor's office and they're thinking, gosh, but something doesn't feel right. I don't feel right. That's why I went to the doctor in the first place, but they said that I was fine and all my lab tests were normal. And this is the why. We can go every blood test down the road, ladies. We could look at vitamin D. We could look at vitamin B12. We could look at cholesterol. We could go on and on and on and on down the road. And all the lab values have optimal reference ranges. So if you're not feeling good, right, and you're on this call, because I don't know why you're on the call, but you know why you're on the call, and you're thinking, hey, I'm here to get some information. I got to find out what's going on with me. I don't feel right. I'm not the woman I used to be. This may be one of the reasons why, right? So we balanced her hormones, this woman, right, who I'm talking about. I helped her with her nutrition. We helped her lose weight. We talked about some lifestyle changes. She got her life back. She got her energy back. She was able to connect with her husband again. So grateful, because she's a grandma and a wife and a daughter, right? Yeah, just like you, just like me, just like all of us. So this slide really is a great visual for the work that we do with people. So when I work with someone, I put together a comprehensive plan that fits all of the pillars that we talked about. And that's really why women get results. If we only work on one pillar or two pillars, you're not going to get to where you want to go. And that's mostly because I've been in practice for almost 20 years, and the women that come to see me have already tried like one or two or three pillars, but they never put them together in a cohesive way. So now we've discussed all the pieces, and you can see why in the situation of breast implant illness, all of the pieces must be addressed in order for you to get the help that you're looking for. And honestly, you're unique. No one has your individualized story, and it's really about finding out what you need and how to get you back on track with the life that you're looking for. So can you leave any of the pieces out? Nope. And that's why many people fail, because they leave some of the pieces out. And it's not hard to be healthy. It doesn't mean you have to cut all of the fun out of your life. But you just do need to be smart about it, and you need a mentor or someone to guide you so that you don't give up before the magic happens. Yep. And so I love this quote. It's a Chinese proverb, and it's tell me and I may remember, show me and I will remember, involve me and I will understand. This is so powerful for me because I like women to understand why they're doing something. No one wants to do something just because, well, they told me to do it, so I'm going to do it. Yeah, I mean, maybe a small percentage of people do that because they're totally desperate and they feel horrible, like they're just beat down. But wouldn't it be helpful to know why? Wouldn't it be helpful to know the backstory of why I'm doing this and how this is helping me? And wouldn't that be empowering? Yeah. And the thing is, what happens at the conventional system is, women will go to their doctor who spends like 8 minutes with them, and they'll say, well, he told me how to go lose weight and to come back in 2 months. Well, how exactly are you going to lose weight? What is the path that you're going to follow? Do you have a hormonal imbalance that's preventing you from losing the weight in the first place? I mean, it's like without a clear path, how are any of us going to be successful? I mean, it just doesn't make sense. It's like, would you give a first grader a math book and say, hey, go home and do this math book, no grown-ups, right? And then come back in a month and I'm going to give you this test. I mean, if you're not coached or explained like how you need to do it. So, I take it very seriously, but we mentor all of our practice members. And it's not something that doctors typically do. But the word doctor means to teach, and I take that very seriously, and for you to have that level of support every single step of the way. And honestly, like, who has the time to spend 2 hours a night researching your condition week after week, month after month, when your kids are like, mom, do you want to take the shortcut, and do you want someone to help coach you and get you there. So here's my family. There's my son and my husband. And, you know, I put this in because I'm like, hey, is it acceptable to simply survive? So for those of you on this call who are just surviving, I don't think it is. Not when I have people who are counting on me. I really want to live. I want to thrive. And you're worth it. And you should want that too. So a little bit about procrastination. You know, Marianne Williamson said, playing small does not serve the world. And it's time to take a stand for your health and get your power back and not give it away to someone or something else. And just allow life to happen for you when you get back in the driver's seat. So if you're struggling with your health, don't waste another day, honestly, of your great, precious life. Get ready to take some action. And honestly, you know, we're here for you. For the last 7 years, we've worked diligently to bring everything that we offer online, and we can connect with you from your home and coach you to your health goals. And it's just really up to you to take the first step. So if you want to take the first step, connect with us, just sign up for your free phone call with us. I'd love to hear about your story and what you're going through, and, you know, and what you have going on, and if we might be able to help you with it. Typically in our office, when we give a presentation, we give people the opportunity to move forward with a complete wellness evaluation. A complete wellness evaluation is valued at $287. Normally at the end of the presentation, just like this one, we invite people to come schedule their evaluation at a reduced rate of $87. However, tonight, even prior to doing any of that, I'm just offering a free 15-minute discovery call to all of you. We want to make sure that you're using your time and your money and your energy wisely, and just even to see what you have going on and if we can assist you with it. So just schedule your 20-minute call with our office, and all you need to do to book it is just go to the website here on this slide. So it's www.Andrea, ANDREA, Purcell, PURCELL.com/call, CALL. And here's what we're going to cover. We're going to talk about you, what you're going through, how you've tried to address your health concerns, where have you been, what are you frustrated with. We'll talk about if I feel like we're going to be able to assist you, and then if we are, how to prepare for your complete wellness evaluation. So at this point, we're going to take some questions, and I just want to answer some of the most common questions that we generally get. The first one is, can I help everybody? And the answer is, I can help the majority of people who are wanting to take responsibility for their health. So no, I can't help everybody, but if you're ready to take responsibility and you're compelled to take your first step and schedule your discovery call, then let's talk some more. The next question is it covered by insurance? And the answer is, unfortunately, no. Insurance does not cover health education or teach you how to take better care of your health. So the next question really is it affordable? And the answer is yes. We have many people who are single parents, retired, partially retired. Once you and I meet, I'll have a better idea of what you have going on, and we can go from there. It's just, I don't know what I would recommend. People ask me, Dr. Purcell, is what you recommend weird or strange, or does it taste bad? Absolutely not. I would never ask you to do something that I have not done myself. And you know, when people say, well, what are you going to have me eat? I say, well, it's all located at your local grocery store. So, you know, don't let that, you know, psych you out or prevent you from booking your discovery call. And then the last question, people say, well, what if I live far away, or what if I live at a distance? And all of our programs, you know, we have practice members literally all over the United States, and everyone does incredibly well because we use telemedicine. So I am going to stick around for a few more minutes. You could type in your questions there. And if you really have something specific, or you want to share a little bit more of your story with me, I'm just going to encourage you to sign up for your free discovery call. It's really the best way to talk about yourself and what your unique needs are. So just a little bit more here. Oh, on how you can book. Here's the link again, www.drpurcell.com/call. If you're on your cell phone right now, you can screenshot it, and then you can hop on the web, and then you can book your discovery call through there. All right, and let me see if I can get out of here and get back to the chat box. There we are. Hello, everyone. All right, I'm back. I'm in the chat box now. And I know Tanya's probably been looking at all the questions and all of that, and I just want to answer your questions. So let's jump in there. And thank you all so much for staying on till the end. And I'm super excited to connect with all of you.
All right, Dr. Purcell.
Hi, Tanya.
Hi, how are you? I do have a couple of questions that have been asked throughout, and one of them is currently Mike has a consultant for an explant scheduled for May 12th. Do you have any pre-op suggestions?
So an explant is scheduled for May 12th?
Yes, ma'am.
Okay, so, and I'm assuming that's from a naturopathic perspective. So, you know, pre-op stuff, if you're taking supplements, you have to make sure that you're not on any blood thinners or things like that. Generally, your plastic surgery office should have reviewed some of that with you. I always recommend that people do vitamin C. I hope you can get some. There's been a shortage because many people who have never taken supplements are currently taking supplements because of this situation. So vitamin C is really good at connective tissue cross-linking and wound healing. So if you're taking some, I would not stop taking it. It's not going to cause any complications during the procedure. Go ahead and take it. My recommendation is 2,000 milligrams a day and even 2 weeks post. So start at pre and then post. Also, many plastic surgery offices recommend arnica, homeopathic arnica, 30C, and you could be taking that 4 times a day to cut down on swelling and bruising.
Thank you. Another question, is there a definite test for BII?
Is there a definite test? Absolutely not. No, because it's just like, those of you who are familiar with fibromyalgia is kind of like a trash can diagnosis. That's what we call it in alternative medicine, because they don't know what's wrong with someone. They say, oh, you have fibromyalgia. And so what's happening with a lot of BII women is they're getting thrown into, oh, you have Hashimoto's, or you have some type of autoimmune thing, or, oh, you have fibromyalgia. But no, there is no specific test. And many women with BII will then go on to develop other autoimmune conditions, and they'll say, oh, that's what you have. They'll try to pin it on that. But P.S., it's BII the whole time.
Thank you. Another question. 3 months post-explant have tested positive for ANA. Working with a holistic doctor, an immune system has been suppressed. Since she has become ANA positive, how would she know if the problem is from the implant or from ANA?
Okay, that's a great question. And then there's also a private question that I was given, which I'm also going to answer after this one, Tanya. So okay. Yeah, ANAs are kind of tricky. They are an autoimmune marker. They can be indicative of potentially developing lupus, but a lot of people with a lot of inflammation get positive ANAs. So was it implant related? I'm sure the implants created a stress on your system. However, you're 3 months post-explant, and it's going to be about another year if you're really working hard with a holistic doctor to move you through and help your system get back on board. I think that it is possible to have your ANA go back down to normal or negative. I've absolutely seen that in a lot of the women that I've worked with that have come to me when the ANA started out positive, but then after really working their program and getting inflammation down, it will normalize. So I want to give you some hope.
Okay.
Okay, and then I'm just going to read this one. We've got another woman waiting to explant. She's got amalgams. I'm assuming they're mercury amalgams in her teeth. Would you suggest I explant 12-year-old implants or remove the 40-year-old amalgams first? I hear you, girl. Yeah. So just a little bit about the case that I talked about the woman who showed up in my office and then she ended up getting explanted 8 weeks later. She just had her amalgams out. So we went the other route. We did the explant first, which is kind of like the bigger elephant under the carpet. And she had a lot of metals, but I don't even test the metals until the explants get out because they're a source of metals. And then we worked to chelate the metals. And, you know, with each person, we have to kind of decide, like, what are we going to do next? Because a lot of the explant in itself is a big stress on the system, like, albeit that couple months down the road, you're going to be better for it. And a lot of dental work is a lot of stress on the system. And if dentists are not properly removing the amalgams, your mercury exposure can increase like 10, 20, 30 fold. And in actuality, that's what happened to me. I got totally poisoned by having my amalgams taken out. And it took me like a good 3 or 4 years to get all the mercury out of my system. So I would say have the explant done, okay, then get on a path and then work slowly to work on the amalgams. I don't know how bad, I mean, we're talking about 40-year-old amalgams, but are they deteriorating? Like, are you about to lose the tooth? Like, is one of the teeth like 3/4 amalgam? Like, I don't know how bad they are, but if they're stable, just keep them there for now.
Perfect. Thank you. Another question is 1 year post-explant was good until about a month ago. Now feels almost as if they were pre-explant. Any suggestions?
Yeah.
Also, there's the twofold question here. I'll let you go ahead and answer that one, then I'll go to the second part of it.
Okay, so that's what's going to happen. So you're going to get explanted, and then if you don't do a whole lot, as far as working with a holistic practitioner to do this comprehensive approach, you're going to get better and then you're going to backslide. And it's really because your system is jammed up with toxins. Your liver is just overrun, your immune system, the level of inflammation, the metals tend to be off the charts. And so you really need to be working with someone to help you go all the way through. And, you know, I talked about that woman. I mean, she's 18 months out now. I mean, so I know we're all looking for a quick fix and we think, okay, the explant is the answer. And it's the beginning of your journey. Kind of like you want to think about it like, oh, we've taken this big stress off the system, but now we have to work and clean up the body and get the body back on track. So I see here you did try DMSA, heavy metal detox right after. It didn't go well. Any thoughts? Yeah, you really need a coach and a mentor. I mean, this is tricky stuff, ladies. I mean, the body is very complex. I mean, you know, we're working on a coronavirus vaccine here, and it's rough. It's going to be slow going. I wish it was a quick fix, and it isn't. And it's the same thing here. I mean, we're dealing with a lot of toxins in the system, immune responses, and organ dysfunction and organ breakdown, and we have to put it back together. So I don't want you to lose hope, but it's hard to do it by yourself. So get help, get a coach, get a mentor, have someone work with you who knows what they're doing.
Yeah, that was the other part of her question is she doesn't feel like she's going anywhere, feels very defeated, and she's eating very well. So
yeah, it's defeating because you're like, okay, I thought I did the right thing. And then we start to second guess ourselves and did the right thing. But now we need to continue. You need to take it to the next level. Let's up level. You know, I wish I could say, oh yeah, do this and you'd be better. But you know, it's each woman is on her own journey and we're all very unique. And, you know, we just really need that step-by-step support and help.
Exactly. One of the ladies stated that she's been sick with severe joint pain and inflammation, has been seeing every type of specialist, and Blue Cross Blue Shield has denied her explants twice. Do you have any suggestions for her?
I would say probably I want to introduce you to Amanda. I know Amanda's on this call. Amanda Porta, and I don't know who hopped on and who heard what, but Amanda reached out to me to host this webinar. She just felt like women needed to get this information, but Amanda herself has been explanted, and she does work with a plastic surgery office, and she might know a little bit more about the ins and outs of insurance and what gets covered and what doesn't. I'm not in the know about that.
Okay.
But I'll tell you something, your severe joint pain and inflammation is real. And I mean, and that research that just came out about a 6-fold increase in rheumatoid arthritis and, you know, all of those autoimmune conditions, they need to go. And I think gut and in your heart, you know, they need to go too.
Thank you. One other question is, do you have a lot of experience with MTHFR?
Yeah. So for those of you that don't know what MTHFR is, it stands for methyl tetrahydrofolate. It's a tongue twister there, but it's the active form of B12 and of folic acid. And basically, people will show up with the MTHFR gene mutation when their livers are really bogged down with toxins. So I don't consider MTHFR a true gene defect or a gene mutation. I've seen it in response to inflammation. And I believe that if you get your inflammation down, just like ANA, your body will methylate again, and and you'll be healthier for it. You'll be able to absorb the folic acid. The workaround for having the gene mutation for MTHFR is just to take the active form of folate, which is methylfolate. And what really is happening in that is that the liver is not able to attach the methyl group to the folic acid. You know, our liver is very, very complex, have over 2,000 jobs in our body. And when someone is dealing with implants and the liver has to handle all of that, it starts to drop balls. So it's kind of like you're juggling all these balls. The liver is throwing balls up in the air. And then it's like, we've got to deal with these silicone polymers. Like, we can't methylate folic acid anymore. And they drop that ball, if that makes sense. And that's what happens over time, is that the liver slows down in function. It can't do all of its jobs because it's so busy trying to clean up the debris of environmental and chemical stress that's coming into it.
Wow. Just a few more questions, Dr. Purcell. Thank you so much. Is there a reason why toxic heavy metals would not show up on a hair analysis test?
Yeah, so a hair analysis isn't the best way to test for heavy metals. There are a lot of tests out there for heavy metals, and it's very confusing. And what I'll say about that is, well, one, I have a degree in environmental science from the University of Massachusetts. And when I graduated, I specialized in public health, and I used to work for the Occupational Health Administration, Safety and Health Administration, as an industrial hygienist in New York State. And one of the jobs that we had was to go into workplaces and inspect them for health hazards, including things like heavy metals, mercury, lead, asbestos, all kinds of chemicals and things like that. And so I have a really vast knowledge when it comes to heavy metals and environmental toxicity and how we get sick and why we get sick. And the testing that I'm doing is urine metal testing. That is a pre-test and a post-test. So post-test uses some type of chelating agent to properly determine how much is being released into the system. More and more heavy metal tests are coming out on the market, and not all of them are accurate as to how much we actually are carrying around in our bodies.
Wow. There is one question. They have food intolerance and allergies, but most concerning side effects is the choking feeling, especially after the person eats. They have a gut, forgive me if I mess these words up, diabetes, and will be explanting, but medicine doctor is currently having them take SBI Protect and glutathione.
I wish I could follow this. I want to see. Oh, okay, I found it.
See it? Okay,
You
thank
don't have
you.
to struggle over it, Tanya. Let me just quickly read this one. I know a lot of this is, yeah, so digestive issues, explant. Okay, you should explant. Just go for the explant. Like, again, the explant is the elephant under the carpet. Nothing's going to get better if you don't get the main source of the inflammation and the runoff. You know, if you're sick with breast implants, you right now, your body is the equivalent of like Love Canal. If you remember that horrific hazardous waste dump in Niagara Falls that pretty much shut the whole city down, that happened, you know, just toxic runoff is just running right down into your liver, through your bloodstream, through your lymphatics. How in the world are you going to get your level of inflammation down? How in the world are you going to heal your digestive system? Your poor functional medicine doctor is going to be like swimming upstream like this, trying to play catch up, and you're not going to get better. You know, all that money on the supplements, the visits, just get explanted and then go from there.
Two more questions that I see is, I'm explanting on the 15th of May. What should I expect after the explant?
That is a very good question. I also want to bring your attention to Amanda Porta, who's on this call, because she's working with the plastic surgery office. She works with women getting explanted day in, day out. She was an explant herself. I mean, she really can give you the ins and outs, and that's why I'm so happy to have her here listening in. I know, you know, this is like her calling, is to get the information out to women. So I'm going to let Amanda take that. I see another question here.
Are you Amanda there? Are you there?
Yes, I'm here. Can you hear me? Oh, hold on. Hold on.
Amanda, I can hear you.
Okay, good. I was saying, okay, hi. Hi, everyone.
Hi, so you got that question. What can she expect after explant?
You know, I think it varies, obviously, for different women. For a lot of us, I know we've had sleep disturbances. So I know for me, the beauty of it, and of course, you've just had surgery, so you are going to be a little tired. I slept for the first time. I say it all the time, in 7 years. I didn't sleep well for 7 years that I really had the majority of the symptoms. So I slept, you know, what to expect. I just want everyone to rest right afterwards is the most important thing. And I realize that women are moms and wives and they're so busy. It's really a time that you just have to take care of yourself, be cozy, get your favorite magazines, let people wait on you is really important, because I think that we just don't know how to let people take care of us. You're gonna possibly have drains in, which is really not a big deal. I don't know. I guess some people don't like them, but I didn't think it was a big deal, and it's very necessary, so they're important. You're just gonna rest. You know, it was difficult for me to lift my arms, say in a motion, like if I needed to reach for something, for several weeks. So you're not going to be doing a whole lot. But, you know, all in all, for me, and everyone's different, didn't have a lot of pain, not like the augmentation itself. And so I want women to like not be so scared of it, because really more than not, they say to me, that wasn't such a big deal afterwards. And I realize everybody's experience is different, but hopefully they've done their research. They've found an amazing surgeon who is board certified and has done many explants. And a great surgeon, you tend to have a really great recovery. I also
Thank you
didn't
so
start
much, Amanda.
detoxing, by the way.
Can you
Sorry
say that
about
again?
Okay, I have a couple more questions that just came in, Dr. Purcell. I don't know if we have the time. Is that okay?
Yeah, I think I know Jane, you have a follow-up question here. I see that you're totally frustrated. You feel like you've been working with some good functional med practitioners. I'd love to have you just set up the discovery call and let's talk more about your unique needs.
Okay. And then one more question is, this person has been told that their blood is quote unquote toxic, that they're unsure why, and have had many tests that have all came back normal. Could it be possibly the implants, and would she start to heal, detox after the implants?
Yes, I would say it could be implants. But I mean, if you've been told your blood is toxic, you must have gone somewhere because you had some symptoms. So I'd be just curious as to, are some of the symptoms that you've been dealing with, like not feeling well, do they hit the definition of breast implant illness? Does it hit some of the things that you've been dealing with? And if it has, then I would look closer into that and consider, do you really feel well or do you feel unwell? And yes, implants could be the cause of it or the source.
Did you have one more time for one or two more? Or?
Okay, it looks like I've got maybe one or two more. Someone has a question here. If they live alone, suggestions for post-op after explant. I think it depends if you have drains or not. I don't know, Amanda, if you had anyone taking care of you after explant or what you recommend for people. So while Amanda's kind of thinking about that, I'm going to have her hop on. I'm going to answer this one. For those of us who are having explant surgery during this pandemic, any words of advice? I know, I was just talking with another woman 2 weeks ago, and we're in the midst of it, and she was the one with the chronic pain ever since the mastectomy, and she really wants to get explanted, and just didn't know what would be the lesser of the evils. But I would say let's get your immune system supported, with the vitamin C pre and post, and just try to eat as well as you can. And I don't know what's happening, in each one of your states. I think each states are opening up on a case-by-case basis. So, are they still doing surgeries starting in May? And then you really just kind of have to weigh the pros and the cons here. If you've been waiting a long time and you're really suffering, well, then let's get them explanted and you'll be on the road to recovery. And, or do you maybe want to push it out another month and wait till it's safe? It's really case by case and state by state.
It looks like that's all the questions, Dr. Purcell. Thank you so much for the answering all that. Look like Amanda's available if you wanted her to take that question.
Yes, so if you're living alone, like patients do ask from time to time, we're not ever going to be able to send you home on your own after surgery, right? Some people have asked me, can I Uber afterwards alone? I say, no, you may not. We cannot let you go home legally on your own. So find a friend, even if it's a friend who can come and at least spend the first 24 hours with you. That's most important. I mean, you know, in a perfect world, you would have some companionship, somebody to help, because like I said, it's a little bit difficult raising arms and so forth. You'll typically go in for your first post-op the next day. So the surgeon can take a look. At our practice, we put an ACE bandage, wrap it around the patient for the first night. So the doctor will make sure that your drains, everything's draining properly, take the ACE bandage off. We put you in one of our kind of ugly bras just at first. We want you to be in that for the first week. And then if you have drains, we just have you tell us when the drains are ready to come out. For some people, it can be a few days. Typically, it's like about a week. For me, for whatever reason, my left just kept draining. So I had them in for almost 2 weeks. And then we kind of, you know, set the rest of your post-ops based on how you're doing and what your needs are and how things are going, if there are any complications, etc. And I didn't drive for the first 3 weeks, more so too. I mean, I could have done like a quick little run to the convenience store if I had to, but I'm more worried about the other people on the road, especially here in California. So I wasn't taking any chances. So I did have friends drive me where I needed to go.
Okay, Tanya, so let's take just one more question, and then I just want to thank everyone for hanging out with us tonight. I think we had a really great conversation, and go ahead if you're feeling compelled, you want to talk more about your unique situation, just sign up for that discovery call. So it's drandreapurcell.com/call.
Perfect. Dr. Purcell, looks like you've answered all the questions.
All right. Well, I was so happy to connect with all of you ladies, and thank you so much to Amanda for helping organize this, and I wish you well.